This is the occipital bone. It is an unpaired bone belonging to the neurocranium. The term occiput means protruded part of the cranium. So this occipital bone, it forms a part of the vault of the skull and the base of the cranial cavity. Now this occipital bone, in the center, it has a large opening. It is known as the foramen magnum. Now this foramen magnum divides the bone into four parts. In front of the foramen magnum is the basilar part. Behind the foramen magnum we have the squamous part. So this is the squamous part. And on the two sides of it, lateral to the foramen magnum, we have the condylar parts. So how do we hold it in anatomical position? In anatomical position, the foramen magnum has to be placed horizontally so that the basilar part will be directed upwards and forwards. The squamous part will be directed upwards and backwards. So this is the anatomical position. And since it is a midline bone, we have to hold it with both our hands. Now let us learn about the squamous part of the occipital bone. The squamous part of the occipital bone, it has two surfaces. One is the external surface, the internal surface. It has three angles, a superior angle and two lateral angles. And it has a pair of superolateral borders, or the lambdoid borders, and a pair of inferolateral borders, also known as the mastoid borders. Come to the external surface. This external surface, as you can see, it has a prominent elevation in the midpoint. This is known as the external occipital protuberance. The most prominent point of this protuberance is known as the inion. Now this external occipital protuberance lies almost midway between the superior angle and the posterior margin of the foramen magnum. From this external occipital protuberance, a pair of arched lines extends bilaterally with upward convexity. These lines are known as the superior nuchal lines. This superior nuchal lines, it forms the demarcation between the scalp above and the neck below. It gives attachment to the investing layer of the deep cervical fascia. Medially, it gives attachment, or rather the origin of the trapezius muscle, and laterally it receives the insertion of the muscle, the sternocleidomastoid, and below that the splenius capitis. Now above the superior nuchal lines, another pair of arched lines extend laterally. These arched lines are known as the highest nuchal lines. These highest nuchal lines, it gives attachment medially to the gallia aponeurotica, that is the epicranial aponeurosis, and laterally the muscle, that is the occipital belly of the occipitofrontalis. Now from the external occipital protuberance, a median elevation, it extends downwards up to the posterior margin of the foramen magnum. This ridge is known as the external occipital crest. It gives attachment to the upper part of the ligamentum nuchae. Now from the midpoint of the external occipital protuberance, external occipital crest, another arched lines extend laterally. These lines are known as the inferior nuchal lines. So an area is formed in between the superior and inferior nuchal lines, and between the inferior nuchal lines and the posterior margin of the foramen magnum. So what are the muscle attachments? In between the superior and the inferior nuchal lines, medially we have the muscle, that is the semispinalis capitis. Laterally we'll have the muscle, that is the obliquus capitis superior. Between the inferior nuchal lines and the posterior margin of the foramen magnum, medially we have the muscle, that is the rectus capitis posterior minor. Lateral to that we'll have the muscle, insertion of the rectus capitis posterior major. Now above the highest nuchal lines, this area of the bone is covered by the epicranial aponeurosis and laterally by the occipital belly of the occipitofrontalis. The posterior margin of the foramen magnum gives attachment to the posterior atlanto-occipital membrane. Come to the internal surface. In the internal surface of the bone, we can see there is another median elevation. This is the internal occipital protuberance. From this internal occipital protuberance, a cruciate arrangement of lines radiate. So these cruciate arrangement of lines, it divides the internal squamous surface into upper two triangular areas and lower two quadrilateral areas. The upper two triangular areas, it lodges the occipital lobes of the cerebral hemisphere, and in the quadrilateral areas lodges the cerebellar hemispheres. From the internal occipital protuberance, a sulcus extends to the superior angle. This sulcus is the sagittal sulcus. This sagittal sulcus will lodge the superior sagittal sinus, that is the dural venous sinus, and the margins of the sulcus will give attachment to the dural fold, that is the falx cerebri. Now come to the transversely. Over here, from the internal occipital protuberance, transversely lines extend up to the lateral angles. Over here we have two sulcus, that is the transverse sulcus, which contains the transverse sinus, and the margins of the sulcus give attachment to the tentorium cerebelli. We've already learned that the tentorium cerebelli, it forms the boundary, it forms the roof of the posterior cranial fossa, and it separates the occipital lobes of the cerebrum above and from the cerebellar hemispheres below. From the internal occipital protuberance, a ridge extends downwards. It is the internal occipital crest, and it gives attachment to the falx cerebelli. And this falx cerebelli, over here, it contains the venous sinus, that is the occipital sinus. This is an articulated skull. Let us learn about the occipital bone, its articulation from this articulated skull. You can see this is the prominent point, is the external occipital protuberance. These two lines you can make out are the superior nuchal lines. Above that, these two are the highest nuchal lines. And from here, this is the external occipital crest, and radiating from the external occipital crest, these lines are the inferior nuchal lines. Come to the articulations. This is the superior angle. Here the sagittal suture is meeting the lambdoid suture. So this is the region of the lambda, and the posterior fontanelle is located here in the fetal skull. Come to the lateral angle. This is the lateral angle where the occipital bone is meeting the parietal bone and the mastoid part of the temporal bone. So this is the region of the posterolateral fontanelle in the fetal skull, and in case of the adults, this is the region of the asterion. Come to the borders. So these two are the superolateral borders. These superolateral borders, they articulate with the posterior margin of the parietal bone. So this is the parietal bones, and it forms half of the lambdoid suture. This is the inferolateral border. The inferolateral border extends from the lateral angle to the jugular process, and this border, it articulates with the posterior margin of the mastoid part of the temporal bones. Let us now view the interior of the base of the skull. This part is the anterior cranial fossa, this is the middle cranial fossa, and this posterior region is the posterior cranial fossa. And here we can see the opening, that is the foramen magnum. Here is the region of the internal occipital protuberance, and the sagittal sulcus is going upwards towards the superior angle of the occipital bone. The margins of the sulcus, it gives attachment to the falx cerebri, attached margin, and it lodges the superior sagittal sinus. From here, from the internal occipital protuberance, extending transversely are the transverse sulcus. The margins of the transverse sulcus gives attachment to the tentorium cerebelli, and this transverse sulcus lodges the transverse sinus. So this is the right transverse sinus, and this is the left transverse sinus. Over here you can see the transverse sinus is bending downwards. So this bend is the sigmoid sinus. The bending of the sigmoid sinus, it occurs at the posterior-inferior angle of the parietal bone. So this over here was the posterior-inferior angle of the parietal bone. That was the region of the asterion. So over here is located the sigmoid bend of the sigmoid sinus, this region. So it is said that the superior sagittal sinus is usually continuous with the right transverse sinus, and the straight sinus with the left transverse sinus. And this sigmoid sinus. The sigmoid sinus will be continued as the internal jugular vein passing through the jugular foramen, this region. As we have already seen, this was our model of the dural fold, the falx cerebri. So this was the falx cerebri with the attached margin containing the superior sagittal sinus, and this was below the inferior sagittal sinus. Where the falx cerebri meets the tentorium cerebelli, we have this is the straight sinus. The straight sinus is formed by the inferior sagittal sinus joining with the great cerebral vein. So this superior sagittal sinus is usually continuous with the right transverse sinus, and this straight sinus with the left transverse sinus. And the attached margin, this is the tentorium cerebelli. It gets attached along the transverse sulcus like this and forms the roof of the posterior cranial fossa. This is the basilar part of the occipital bone. This basilar part, it lies in front of the foramen magnum. It has an anterior surface, it has a superior surface, inferior surface, this is the inferior surface, and it has two lateral margins. The anterior surface, this anterior surface, it is rough, it is quadrilateral, and this will articulate with the posterior surface of the body of the sphenoid. So this over here is the sphenoid bone, this over here central region is its body. So this anterior surface of the basilar part, it articulates with the posterior surface of the body of the sphenoid. It forms a primary cartilaginous joint. The superior surface of the basilar part of the occipital bone, it lodges a part of the brainstem, that is the pons, and the upper part of the medulla oblongata, and it gives attachment from before backwards to three structures: the membrana tectoria, the upper band of the cruciate ligament, and the apical ligament, which pass through the anterior compartment of the foramen magnum. Over here I have made a model showing the three structures. This is the atlas, and the lower one is the axis. So these three structures, this is the pink one is the apical ligament, behind that is the upper band of the cruciate ligament, and this is the membrana tectoria. This membrana tectoria is the upward continuation of the posterior longitudinal ligament. If we remove this, then we will be able to see this structure. This orange structure is the transverse ligament of the atlas with its upward band, that is the upper band of the cruciate ligament. When we remove this, we see from the apex of the odontoid process we have the apical ligament. So we have the attachment of the membrana tectoria, the upper band of the cruciate ligament, and the apical ligament from before backwards. This is the inferior surface of the basilar part of the occipital bone. This inferior surface is directed downwards and forwards. Close to the anterior margin of the foramen magnum, about 1 centimeter in front of it, there is a tubercle. This tubercle is known as the pharyngeal tubercle. The pharyngeal tubercle gives attachment to the upper end of the fibrous raphe of the pharynx, where the constrictor muscles of the pharynx are inserted. The inferior surface of the basilar part of the occipital bone also gives attachment from behind backwards to the prevertebral layer of the deep cervical fascia, the buccopharyngeal fascia, and the pharyngo-basilar fascia. And this surface, so this inferior surface, it forms a part of the roof and posterior wall of the nasopharynx. This is the temporal bone. This is its squamous part. This over here is the mastoid part. This is the petrous part. This is external, this is internal. This is the posterior border of the petrous part of the temporal bone. These are the lateral borders of the basilar part of the occipital bone. These lateral borders will articulate with the medial part of the posterior border of the petrous part of the temporal bone by sutural ligaments. So along the line of articulation over here, you can see that a groove is formed. This groove will lodge the inferior petrosal sinus, which is the first tributary of the internal jugular vein. The condylar parts, they lie on either side of the foramen magnum. So these are the condylar parts. It consists of the condylar part proper. So these are the occipital condyles. So these are the condylar parts proper. And we have the jugular process. This is the jugular process. First is the condylar part proper. So this condylar part, it consists of the occipital condyles. As you can see, these occipital condyles are convex. They are obliquely placed and they are oval or rediform in shape. These occipital condyles will articulate with the first cervical vertebra, that is the atlas. So this is the atlas or the first cervical vertebra. It is a ring-like bone. It has a small anterior arch, a long posterior arch, and it has two lateral masses. The occipital condyles will articulate with the superior articular facets of the lateral mass of the atlas and will form the synovial atlanto-occipital joint. The medial margin of the occipital condyles projects into the foramen magnum, and it presents a tubercle which gives attachment to the alar ligaments. Above the occipital condyles, at the junction of its anterior 1/3 and posterior 2/3, there is a canal. This canal is the hypoglossal canal. This hypoglossal canal allows the passage of the hypoglossal nerve, the meningeal branch of the ascending pharyngeal artery, and sometimes an emissary vein. Behind this occipital condyle, there is a fossa. This depression, it is known as the condylar fossa. The condylar fossa allows the accommodation of the upturned posterior margin of the superior articular facet of the lateral mass of the atlas during full extension of the head in the atlanto-occipital joint. Sometimes a canal may be present in the condylar fossa. This is known as the posterior condylar canal. This posterior condylar canal, it transmits an emissary vein which connects the sigmoid sinus with the suboccipital venous plexus. The posterior part of the jugular tubercle is marked by faint grooves. These grooves are for the passage of the cranial nerves, the 9th, 10th and the 11th cranial nerve, that is the glossopharyngeal, vagus and the spinal accessory nerve, which pass through the intermediate compartment of the jugular foramen. The jugular process are quadrilateral plates of bone which projects laterally from the posterior half of the occipital condyles. So these are the jugular process. So each jugular process, it has an anterior margin, lateral margin, and it has an upper surface and a lower surface. So this anterior margin, it forms the posterior boundary of the jugular foramen and transmits the internal jugular vein as a continuation of the sigmoid sinus. The lateral margin will articulate with the petrous part of the temporal bone by a plate of cartilage, and the cartilaginous joint is later replaced by bone after 25 years. The inferior surface is rough and it receives the insertion of rectus capitis lateralis. The upper surface of the jugular process is deeply grooved for the terminal part of the sigmoid sinus before it runs downwards around the jugular notch and leaves through the jugular foramen as the internal jugular vein. The ossification of the occipital bone occurs from 8 centers, 1 for the basilar part, 1 for each condylar parts, 4 for the squamous part, and 1 for the posterior margin of the foramen magnum. Now the squamous part unites with the condylar parts by the end of the second year. The remaining components, they fuse together by the 6th year. So by the 6th year, the bone forms one entity. And by 18th to 25th years, the occipital bone, it unites with the sphenoid. We will now discuss certain important points about this occipital bone. First, the lines of demarcation between the different parts. The basilar part is demarcated from the condylar part by imaginary line passing through the junction of the anterior 1/3 and posterior 2/3 of the occipital condyles. Traced above, this will pass through the hypoglossal canal. Now the junction of the squamous part and the condylar part is an imaginary line passing through the posterior end of the occipital condyles. Next, the obstetrical hinge joints of Boudin. The primary cartilaginous joint between the basi-occiput basisphenoid and that between the condylar parts and the petrous part of the temporal bone, these joints help or facilitate the act of parturition, that is the passage of the baby through the mother's birth canal. How? By reducing the diameter of the fetal head and helping in flexion of the fetal skull. So these joints are known as the obstetrical hinge joints of Boudin. Next come to the articulations of the occipital bone. Now this occipital bone, it shows 3 types of articulations. One is the fibrous joints or the sutural joints at the margins. Next we have the primary cartilaginous joints, that is the basi-occiput basisphenoid and the jugular process with the petrous part of the temporal bone. Thirdly, the synovial atlanto-occipital joint. The basi-occiput and the basisphenoid, this primary cartilaginous joint, this permits the growth in it, or it regulates the growth in length of the skull. The joint between the petrous part of the temporal bone with the condylar part, it regulates the growth in width of the skull. Next, the attachments of the deep cervical fascia. Now the investing layer of deep cervical fascia is attached to the superior nuchal lines, and the prevertebral layer of the deep cervical fascia is attached to the inferior surface of the basilar part of the occipital bone. Next, the venous sinuses in relation to this bone. We have the superior sagittal sinus, the transverse sinus, the occipital sinus. We have the inferior petrosal sinus, and we have the terminal part of the sigmoid sinus. Next, the nerves in relation to this bone. So across the jugular tubercle, we have the 9th, 10th and the 11th cranial nerves. Through the hypoglossal canal, we have the 12th cranial nerve. Through the foramen magnum will pass the spinal root of the accessory nerve. And on either side of the external occipital protuberance, we have the greater and the lesser occipital nerves. The foramen magnum, it is an oval aperture. It communicates the posterior cranial fossa with the vertebral canal. This foramen magnum is about 3.5 centimeters anteroposteriorly and transversely about 3 centimeters. And in the anterior part, the medial margin of the occipital condyle is projecting inwards and gives attachment to the alar ligaments from the odontoid process of the axis. This attachment of the alar ligament divides this foramen magnum into a small anterior compartment and a large posterior compartment. This anterior compartment is also known as the osteoligamentous compartment. Structures passing through this anterior compartment, we have already learned from before backwards. We had the membrana tectoria, the upper band of the cruciate ligament and the apical ligament. The structures passing through the posterior compartment of the foramen magnum, also known as the neurovascular compartment, are the lower end of the medulla oblongata and the meninges, the fourth part of the vertebral artery surrounded by the sympathetic plexus of nerves, the spinal root of accessory nerve, anterior and posterior spinal arteries, and occasionally the tonsils of the cerebellum, projecting on each side of the brainstem.